Welcome to Founder Tactics, a podcast about entrepreneurs and the communities that shape them. I am your host, Julia Lucidi, and today I had the opportunity to interview Samson Magid, the co-founder and CEO of HealthSnap, one of the largest virtual care management solutions in the U.S., transforming how healthcare providers support patients with chronic conditions. 10 years ago, he casually partnered in class with close friends and his university teacher to design and implement a research project, a project that eventually led to the launch of a business. It's unbelievable to hear the growth that they have experienced in the past 10 years. Under his leadership, the company has grown to 500 employees, partnered with over 150 health systems, managed care for more than 100,000 patients nationwide, and secured 3 patents for its innovative virtual care platform. HealthSnap also raised $48.5 million in venture funding over 6 rounds, including investors like Sands Capital, Comcast Ventures, and Florida Funders, to name a few. In this episode, we had a chance to dive into the reality of building a high-growth startup, and Samson was an open book. He shared how he's been able to develop resilience and a clear vision, surrounded by a strong community of loved ones, incredible friends, and mentors in the process. I can't emphasize enough the magnitude of what him and his team have accomplished, given that the healthcare system is layered with complexities. And over time, trial and error, they've been able to develop a very strong, valuable business solution. Needless to say, he's a founder that I felt very lucky to sit down with, to have this conversation, and to learn from. Before we dive in, if you want to hear more insightful discussions with leaders like Samson, be sure to subscribe or follow us on the platform you're listening to us on right now. Thank you so much for joining us today. We appreciate your support and can't wait to bring you more great content. Let's dive in. Okay, cool. So we're rolling.
Awesome.
Welcome.
Thank you for having me.
I'm really excited to have this conversation. I've followed your work for quite some time, just having worked at CIC, and you were a CIC client, but I never really went into super depth into what HealthSnap does. And I think in recent events that we've been in together has been kind of like a window into your founder experience and into HealthSnap. So I was very excited to have you on the podcast. So thank you for making the time to be here. I think we could start with an introduction on you. So tell us a little bit about you.
Yeah, absolutely. So my name is Samson Magid. I'm the co-founder and CEO of HealthSnap. I'm a New York native, but I've since been a Floridian convert. I actually moved here as an undergraduate in 2010 to go to the University of Miami. So I was pre-COVID. I've been here in the come up of South Florida and Miami. But I grew up in Long Island in New York, went to University of Miami for undergrad and graduate school, had one winter down here and never left. So I'm sold on Miami. I'm going to be here long term, with my wife and family. And we definitely love being in Miami and living here and building down here as well, especially. My whole life, I wanted to actually be a physician. It was my lifelong dream, was to get into medicine. I love science. I love helping people. I played sports my whole life. And so in my head in high school and going into college, becoming in like orthopedic surgery or sports medicine was the thing in my mind that I was going after.
What sports did you play?
So I played football, I wrestled, and I played lacrosse.
Nice.
So all 3, I was competitive in all of them. I actually started wrestling in elementary school. My parents were crazy enough to put me in like a wrestling camp in 4th grade, and I was hooked.
Wow.
So that was definitely my most competitive sport, which translates really well into entrepreneurship, and we can definitely talk about that.
Oh, wow.
So as an undergraduate, I was an undeclared major. I was trying to figure out, like, I didn't want to do biology or chemistry. Those are really like boring, invisible science type stuff. And I probably wasn't quite nerdy enough to want to major in one of those. But, I was trying to figure out what I wanted to apply the science to, but had kind of that sports and nutrition and, exercise background that I had.
So sports is what initially kind of opened your mind to what you might want to do professionally.
It did. Yeah. I mean, I was, this can come off as like boastful, which it's not at all, but I was the captain of all 3 teams.
Wow.
I was on varsity for 11 seasons across the 3 sports. And I think leadership was something that came to me naturally. I never was like, hey, I want to be the captain of a team. It just naturally happened. And I think, like I said, that translated really well into my friends and my community and what has now become my life with work. And yeah, I think sports taught me a lot about life and the highs and the lows and the challenges and perseverance and commitment, especially
Yeah.
throughout my time in competitive sports.
Yeah. I started training martial arts when I was 20. So it was kind of like after everybody else had done like a lot of sports growing up. I didn't. I rode horses for about 10 years. And then I got into martial arts, martial art called capoeira. Have you ever heard of it? It's like a Brazilian
Yeah,
dance fight.
yeah,
And it really was amazing to me how much sports really tests you psychologically and makes you a lot more resilient. I think it's taught me a lot in building up that resilience. So I'm curious about like what it brought out in you and what do you feel like transferred? Like feel free to dive into that.
yeah. I mean, there's probably a couple of notable moments in my wrestling career that I think taught me about that level of commitment and perseverance. But I was a ranked wrestler in Long Island. I was competitive. I was an all county wrestler. And my senior year of wrestling, going into the playoffs, about 2 months before in practice, a former teammate who had graduated, was in college, came down. I was training with him, and in practice, I dislocated my elbow.
Wow.
I tore 3 ligaments in my arm, and this was 2 months before our like playoff run and counties and potential states. Like that's what I was gunning for, and I was so committed. I was in the best shape of my life, and I had a freak accident. And you kind of have to grapple with that and make a decision of either, hey, I'm gonna have to bow out and that's it, and you deal with that, or you lean into what you think is impossible at the time, but you commit to recovery. And I was like, screw this, I'm gonna go to physical therapy twice a day. I'm gonna try to figure this out. And then I ended up rehabbing enough to get back in time while wearing an arm brace, and chose not to get surgery to get back into the counties. And I ended up pretty much wrestling with one arm,
Wow.
to get back into the playoffs. And I ended up placing in counties, but didn't get to the ultimate goal. But that just taught me a lot about there are decisions you can make when things get really, really hard. And action, I think, is the thing that for me was like, hey, you can either kind of pull yourself up and take action and get up and go, or sulk and feel bad about it. And that is for everything in life, I think, and taught me a lot about myself and what was possible, even though mentally you might be like, hey, I'm at the lowest possible point right now. But when you start taking action, even just one day at a time, you start realizing, all right, we can do this, we can figure it out. And then you have a whole supporting cast around you between friends, family, and teammates. Again, that translates into what I've experienced in my entrepreneurial journey really well.
That's really cool. I've gone through some pretty big injuries as well. I had a labral tear on my left hip in 2017. I still train martial arts. And I remember when I went through it, I like almost didn't want to tell people about it because I was afraid that I would never heal. Like it's just so big. And when an injury comes into something that you like love so much, it can feel so like crushing and debilitating psychologically, emotionally. And, I chose the route of I'm going to give it all for my recovery. And I have like full rotation on my hip, which
Amazing.
is amazing.
Yeah.
It's a tough joint to recover. And I'm curious to know like what about your upbringing developed such a strong leadership quality in you at such a young age that you were able to then kind of channel that into sports? Like, were there other things in your upbringing that shaped you?
Yeah. I have an older brother. And so as a younger brother, you always look up to your older brother. He played the same sports as me. And it was always aspirational in my mind, and also a challenge of like, hey, I'm going to get to a point where I can beat you in everything. Just the nature, I think, of being
Totally.
like guys and brothers. And we were hyper competitive in all of our sports. So I think he was always a role model for me and my parents as well. They gave me the space to, have the opportunity to, make my own decisions. They never told me what to do, but they always said, hey, here are perspective around what you can do right now. And ultimately you can make that decision. And I think they taught me how to be autonomous in decision making, but also try to always do the right thing. And just kind of coach me around that without being prescriptive.
Hmm.
And I think that's what really, really good mentors do. And I had that at a really young age, and was fortunate to have an amazing, amazing support system between my brother and my parents and my friends, that really made sure that, hey, I had the support I needed, but never were prescriptive in telling me what I needed to do.
Yeah. Tell us a little bit about your grandfather, because I know he played a big role in your story. Who was he? What was your relationship with him like?
Yeah. Yeah. Yeah.
What was his name?
Yeah. So his name was Abraham. So Abe.
Huh.
He was awesome. He was a self-made entrepreneur. So like him, he had a couple of business partners. His parents and my great grandparents, immigrated to the U.S. From Eastern Europe, and they were kind of like the post-war first gen. Hey, we're going to be able to start family generational businesses, and they started a real estate business back in the 60s and the 50s, and built it from nothing. And my father and my dad has three siblings, and they all joined the family business. My brother joined the family business. I had I had an opportunity to join it as well and go and do the thing with them. And I said, hey, I'm going to go off the beaten path here and figure out my own thing. But my grandfather, at a young age too, my grandparents took me and my cousin around the world. They traveled with us. They showed us other cultures. They exposed us to different walks of life and what that meant, to understand, like, hey, it's not just where you grew up and the people that are like you, but there's other people around, other cultures, other types of ways that people live. That to me was something that opened my eyes up at a very young age. I mean, they took us to Morocco in third grade, like, to give you an idea of the extremes. We were in Bosnia and all over. Again, very fortunate and grateful to have those opportunities. But it just exposed me at a young age about diversity and other people and parts of the world that most, don't I think get, or maybe later in life they might start meeting other people
Yeah.
and have a tough time trying to relate to them. And I think I understood that, hey, there's all walks of life and perspectives. And so his, I think, entrepreneurial mindset and ability to generationally bring that down to my father, my uncles, and my family as well was something that I was the ultimate role model for me growing up. It was always something that I looked at of like, whoa, like this is what that looks like. And he was, probably the hardest worker I knew, and I think it translated to my family directly.
Yeah, that's awesome that you had such a close relationship with him. And I think in the US particularly, we can really be in a bubble. And for you to be able to have that experience and see like what the real world is
Yep.
like
Yeah.
sometimes.
Yeah.
I know that we have our own challenges in the United States, but when you go to other countries that are less developed, you really understand how much more complex I think things can be. And for me, I'm Brazilian. I was born in Brazil, raised across Atlanta, Mexico City, the south of Brazil, now Miami. And so having kind of like many of those experiences outside the US helped me really appreciate being in the US. And it's also one of the reasons why I love being in Miami, is because I feel like it's such a point of convergence of so many cultures. So I really appreciate being in spaces that are multicultural for that reason too.
Yeah, completely. I mean, not only that, but also the sports too. You're with very diverse people that
Totally.
come from nothing or come from a lot, and everything in between. And your ability, and I think that's like the leadership quality of being able to like recognize perspective, recognize that not everyone came from the same backgrounds, and people have very different perspectives around life and what's important to them, and what opportunities they had growing up. And I think your ability to flex around all of that and understand and actually like create empathy in a working or a non-working environment for very diverse people is what creates a sense of trust and community. And that, again, that translates into, how you can get a really broad group of people to come together for a common goal. And to me, that's like business building 101, especially early stages of a company.
For sure. So whenever you were in New York and you decided to go to school at UM, tell us about that period, because I think it was around that time that you started to explore kind of a project or research project that eventually led to HealthSnap, right?
Yeah. Yeah. I'll never forget it. My first semester freshman year, I stumbled across a nutrition class. I sat in that class and I really didn't expect much. I thought it would just be like what I had typically known about nutrition. But when we got in the class, we were actually learning about how nutrition directly is correlated to all of the major chronic conditions in our country, how high blood pressure, heart failure, diabetes, obesity, cancer are nutrition and lifestyle related conditions. And our country is dealing with an unprecedented epidemic. It's actually a pandemic around the world if you look at all the chronic disease stats around the globe. But in the US especially, the trends are pointing in a direction that are already and becoming more unsustainable over time. It's one of the top topics right now in our government right now around chronic disease management. And so that opened my eyes to a whole another perspective around how science, and then what I loved was like the applied science side of it. So like nutrition and diet and exercise affect all of that. And I immediately declare my major as exercise physiology. Most people, when they hear that, they think like, oh, you're going to be a personal trainer, or it's like more health and wellness. But our program was 90% pre-med students, and every single class was about the science behind chronic diseases. And I was hooked. It became my passion. My best friend in college, who's now my co-founder, and then our professor at the time, who's our other co-founder now, we started kind of thinking about the current like chronic disease delivery system. And if you think about your healthcare experiences, even ourselves, or I bring it back to my grandfather, he had a heart attack in his 40s. He was diagnosed with type 2 diabetes in his 60s. He had another heart attack in his 70s. Because his diabetes was not managed properly, it's the leading cause of blindness and limb loss. They had to amputate his entire left leg, like really bad stuff.
Wow, that's difficult.
And his story is not unique. I share a story all the time because it's obviously near and dear to me. It's my why. But that's the status quo. You go to the doctor, they give you medicine, you go home. 6 months later, you have a follow-up. They then react to whatever change in that 6 months of a black box. And then they're giving you more medicine or changing your dosage, and no one's helping you between your care, and no one's giving you any dietary or lifestyle or behavioral change modification, which is how these conditions form in the first place. Right. So the treatment of the conditions didn't match with the etiology, how they actually form in the body over a long period of time. So we had a mismatch. So as an undergraduate, we said, well, what if we flip that paradigm? We started monitoring people in between visits. We started giving them personalized dietary strategies, personalized exercise plans, personalized behavioral change modifications. And that really set the foundation for what eventually became HealthSnap. But we were doing this with the University of Miami employees as a corporate health benefit. We had 50 student interns over the 4 years that we were doing this. We were collecting so much data on individuals. We were going to fairs and corporate health benefit events through the university. And we started just seeing the reactions of people, because when we were working with them on the spot, we would create algorithms that would give them basically a personalized routine on the spot, and they were blown away. And we're like, okay, we're onto something here. Like basically giving people what they would pay thousands of dollars for in less than 5 minutes, and through a really unique assessment that we were doing. And so we knew we were onto something then. I was still pre-med and going through it. But when we started flipping the script on its head of saying, well, what if we started monitoring people and giving them personalized treatment protocols when they needed it most, you started to see the outcomes. Much reduced blood pressure readings, lower glucose readings, lower hemoglobin A1C.
You were already gathering that data?
All of it.
At that time?
Absolutely. We were doing all of that. And that was all the algorithms that we were refining and building and giving all those insights to in a report during all these different wellness events.
But did you already deploy devices? Like, did you have devices that people would take home and monitor? It was already
So this was in 2011. We were doing this in person. So it wasn't connected devices. It wasn't remote monitoring in the way we're doing it now. It was like version 0.5 of, hey, we're going to, if I was sat with you, I would take your blood pressure and I would write down your blood pressure and put it into our software. And then I would take, all of your readings, and then we would click submit, and then it would generate a report and print it out, and you get it at that time.
And then you would do that frequently with the same people to be able to track their progress.
Correct. And they were tied to a benefit. They would actually save money they would get different rewards and benefits by participating over time. And if we were able to show a lower blood pressure for them, they would get savings in their plan through the university.
Super good.
Yeah.
That's so creative how, you were essentially doing customer development at the time, right? Figuring out, because in the process of building a startup, you want to talk to your customer, who you think your customer is, as much as possible to understand their pain points. And were you aware already that like, wow, this is like the process that I'm going through to actually build a company? Or was it still in your mind like this is a school project and I'm just doing my best? Like when did that key turn in your head? You're like, hey, I think this is a viable business model.
Yeah, 100% the latter. We were students at the time. This was a school project, 100%. We're doing research mainly it was for our CV, honestly. In my head, I'm going to medical school.
Okay.
So I'm doing research at the time. It's really novel. It was something that we loved doing. But the idea of a business wasn't even close to a concept in our head at that point. And we were just starting to kind of say, hey, yeah, this is novel. This is the way we're supposed to be doing this. But we were solely focused on, hey, this is research for us right now that we can use to get kind of a leg up in the interview process for medical school.
Yeah.
That's where we were at.
Yeah.
A business was so far off the radar back at that time.
When did the key turn?
If you flash forward like 3 years, we had 3,000 employees go through their program. It became really big, and it actually still exists today. It's a corporate
That's awesome.
yeah, which is amazing. At that point, myself and Chase, who's my co-founder, and Dr. Wesley Smith, who was a professor at UM, we had 50 students that had worked underneath us over every year. And I kind of was at a crossroads, right? I took my MCAT. I'm ready to go to medical school as a senior. That year was like the turning point for me, and more of a life event happened at that point. My grandfather passed away that year. And so I was thinking, hey, we're onto something. We knew we had something there that was the way that chronic diseases should be managed and delivered. And we knew that it was different than we'd never seen anything like it. And so that's when it started to click for me of saying, well, my grandfather's story is not unique. Half the US population is living with at least one chronic condition. We spend 96 cents per dollar of all Medicare dollars on treating preventable chronic diseases.
Wow.
There's a much bigger opportunity here. And so we kind of had a come to Jesus moment and said, let's keep doing this. Let's see it through.
Do you feel like with your grandfather's passing and grieving, it's such a moment of reflection to have that big of a loss? How did it impact you in that moment?
Yeah, I mean, it kind of goes back to like the decision point, right? You can either sulk and sit there, and like I said, with like my injury, not to compare, they're very different, obviously, but something that you kind of say, all right, I can either take action and try to change status quo, which I think is where the best entrepreneurs come, because they have something that's deeply personal. They're hyper passionate about solving the problem, and they're obsessed over it, and they're going to commit to trying to change the status quo of a very big problem. Or I could just say, life happened to me and that sucks, and I'm not going to do anything about it, and I'll just keep going on with what my plan was.
Yeah.
And I just, again, I think I reflected the most on his story is not unique. There are so many people just like him that would benefit from the work that we were doing, and shame on us if we don't see it through.
Yeah. Interestingly enough, my grandfather also passed away from chronic disease. I never met him, unfortunately. It was my dad's dad. And so all I have is kind of memories of what my dad tells me, like that he was state champion 7 years in a row for disc throw in Brazil.
Wow.
And some cool things that I still like, even though I never met him, I carry that, but it's, unfortunate / interesting that, it's a commonality, so that's really incredible that you're working on something that impacts people in their lives and their relationships so much further than you can probably even measure.
Yeah, completely. Every time I talk to an audience or a group or like every new employee at the company, I make time to meet with them and I ask them their why. And I say, how many of you are not happy with the status quo in healthcare right now? How many of you have had a family member or a friend or yourself that has dealt with a chronic condition? And I tell my grandfather's story, and I kid you not, like 100% of the time, whether the cohort of new employees is 5 or 20, or there's at least 1 or 2 people that tell their story in public and they start crying.
Yeah.
And it's so deeply personal. And again, like that worthy cause is what I think makes an entrepreneur and an entrepreneurial journey worth it is not the right word, but it makes it so meaningful, and it keeps you going when things get
The
really
fuel.
tough. Yeah, it's the fuel.
Yeah.
Exactly.
So before we go a little bit further into HealthSnap, like let's do a quick pitch. What is HealthSnap for the people who are listening and haven't heard of HealthSnap before? I think we've given them a good teaser.
Yeah, absolutely.
But like, give us the pitch. What is HealthSnap today?
Yeah, I'll give the simplified explanation. So, like I said before, the status quo, right? You go to your doctor, they take your blood pressure in the room, or they take your glucose reading. You go home, and then 6 months later they do a follow-up, where they do the same thing. And then in the office, you're getting medication changes or prescriptions or a care plan. We flip that all on its head. So instead of going to the doctor, we're actually sending a patient that has high blood pressure a connected blood pressure cuff. They take their readings at home. When they take their reading, it immediately gets sent to a nurse on HealthSnap's team. That nurse is then monitoring that patient remotely and then helping them with personalized education, care plans, care gap closure. So if they have like a preventive appointment they need to schedule, we're doing all of that. So all that care coordination work we support, and we're a full service virtual care management solution. So we partner with hospitals and health systems around the country. We work with 4 of the top 25 health systems, and we're basically powering chronic disease management in the home. So regardless of the chronic condition someone has, we're sending them a connected device. All they have to do is start using it. It will transmit data automatically through the cellular network. And then we have clinical staff members that are monitoring that data, calling those patients every month and providing access to personalized care when and where it's needed most. And so we are focused on all of the major chronic conditions. There's over 40 conditions that we support, from cardiovascular related ones to oncology to pulmonology disease like COPD and asthma. And for the health systems that we work with, the clinicians are able to work with more patients and more of the right patients because we're giving them actionable data remotely, so they can titrate medications now remotely. You don't have to actually go to your doctor anymore. So we're giving people the care they need at the point in time when it happens, as opposed to 2 weeks later when a critical health event could already occur. Like my grandfather, for example, he was being monitored. We could have intervened probably a lot faster, but instead we weren't catching anything.
Right.
And then he would have, severe chest pain or symptoms, and then he'd be in the hospital. And that's costing the system more money. And then we're in the ER dealing with something that could have probably been prevented 2 weeks before with a med change or an office visit. And so we do all the remote monitoring, we do chronic care management, all these different care management programs that Medicare has created over the last decade to support care in the home, and specifically chronic disease management in the home.
So this is a very complex issue that you're solving, because we're talking about the patient experience, which it's an aging population that is not very well integrated with the internet, with devices, etc. We're talking about the healthcare system that is overburdened, doctors with excessive work, nurses burned out, working a lot of hours. We're talking about the reimbursement system, which is also complex and fragmented. What else is there? There's more to it. But there's a lot of layers. So yeah, those are big ones. I'd love to dive into like I mean, like, let me think of how to phrase this. How was HealthSnap able to get to a point where you guys had a solution that bridged so many extremely complex scenarios? Because essentially you guys are serving patients in the home, connecting their data and relaying their health status to clinicians, to clinics, to physicians, and to nurses, and being able to do that in real time while there's a hospital that's super busy, a doctor, a physician treating patients, and then they still have to bill for that.
Yep.
So even if you got everything previous right, but they couldn't bill for it, you're like out the door.
Correct. A lot to unpack there, but I'll start off by saying we learn by making a tremendous amount of mistakes and by being very naive, passionate individuals that we were like, patients are going to get better. We have data, do this, but there was no economic model around all of it.
Right.
And I think this is a really good example of one, never giving up because your market's going to change around you. Two, the idea of like product market fit is not just your product, but how the market changes over time too. And the market will change over time too. And your product will then need to change over time to make sure you maintain product market fit. It's not a, on off switch. You don't obtain it and then that's it. Oh, we got product market fit and we're good. You have to continue to innovate and adapt to what's changing around you in the market as well. And a lot of time of just testing and iterating and working with different types of partners to understand their challenges and the types of challenges that will change as you go from a very small private group to an enterprise health system, like in Miami, a Baptist Health South or University of Miami Health System. Like those are the 800-pound gorillas that every entrepreneur or startup wants to work with, but they will swallow you up and potentially kill your company if you're not ready to work with those types of organizations.
Yeah. Can you break down for people who are listening, like what is the, I don't know if the right term is business cycle, but what is from patient to perhaps even, I guess, physician billing, what are the steps that happen so that people get like a full understanding of the HealthSnap cycle?
Yeah, absolutely. So we work basically through like your primary care, right? So you go to the primary care doctor. Let's say you have high blood pressure and type 2 diabetes. Your primary care doctor would order remote monitoring and or chronic care management through HealthSnap. So we power the whole program for them. If they order that program, then we will call that patient and say, hey, Mrs. Jones, Dr. Smith has recommended this program based on your high blood pressure, your diabetes. We want to send you he wants to send you a connected blood pressure cuff in your home and have a nurse working with you 24/7 to make sure that you're staying healthy at home between office visits. If the patient says, yes, I want to participate, that sounds great. They've now consented to the program. Once they consent, we will then send that patient a blood pressure cuff. We do all the shipping and logistics of the equipment piece of it, so the health system doesn't need to deal with that. So that's kind of one piece. The patient enrollment and activation is the second piece that we do that they don't have the staff or the time to do. So now we've got the patient to consent. We've now shipped the device. The device through our software is now pre-configured to the patient's record. And it's cellular enabled. So you talked about, we're dealing with Medicare patients. They're 65 and older, lower tech literacy. When we send the blood pressure cuff to their door, all they need to do is open the box, start using it, and that's it. They don't need Wi-Fi. They don't need a smartphone. That's a good example of like in the earlier days of the company, we're like, oh, we'll build a mobile app and the patients are going to use it. They're going to send them all this data. We had zero usage and we're like, all right, we have to pivot really quick right now. And we spent a lot of money on building a gorgeous mobile app for iOS and Android. We still have it and it's fine. But most patients are just very happy with taking their readings in on the phone or through SMS.
Yeah.
So that was a good learning. Once the patient gets the device delivered, we then track that and we coincide the first nurse call with the patient when they get the device. We have them take a test reading. That's the first aha moment because they take a blood pressure reading, immediately sends. The nurse goes, oh, Mrs. Jones, your blood pressure today is 148/90. And they go, oh, whoa, okay. So this works. Really, really cool. And then the nurse is going through a consultation to say, hey, based on your high blood pressure and your diabetes, here's your care plan. Here's all your recommendations for diet, for nutrition. The patient gets that care plan sent to them via direct mail or through email or through our portal or the mobile app if they are tech savvy enough to use it. And then every time they take their readings, the nurse is monitoring it. And we have different protocols that say, hey, if the blood pressure for this patient is above a certain threshold, we then call that patient proactively. And we say, hey, Mrs. Jones, we notice your blood pressure is high today. How are you feeling? Do you have any symptoms, chest pain, etc.? And we're coordinating care for that patient. So if they are out of range, if they have chest pain or they're symptomatic, we're then notifying the clinician through the electronic health record, through our integration, that we have an interface through the medical record, which is novel. And the clinician then is able to intervene directly at that time. And we have protocols that say, do we schedule an office visit for that patient, which is now helping with access to care? Do we titrate medication remotely? So we're adjusting care plans in real time and being proactive in that patient's care. And then I think the part that's often overlooked in these types of initiatives is that we, in our staffing side of it, have dedicated nurses to a patient, meaning that it's not a call center. So the patient and the nurse are building a trusted relationship and bond more than they typically would ever get with the traditional healthcare system.
Totally.
You don't typically know the nurses, they're just a person that takes your vitals and you move on. our nurses and the patients are building some multi-year relationships, and they're talking about everything from not only their health, but their life. My dog passed away. I feel lonely. I'm depressed. I'm isolated. And we're coaching them through all of this. And that level of access, that level of personalized care and connectivity creates trust and security, which is what's driving the patient engagement and the access to personalized care that they would never get if they were going through the traditional system.
I also think that there's a relational benefit to health, right? So like when you have stronger relationships and connection, like social connection, you have health benefits. So I think that I know you guys have incredible metrics of improved health stats for the patients.
Yep.
It's sometimes there's things that's hard to measure,
Yep.
like happiness, anxiety, how they're emotionally feeling better and how that's affecting their health. And I think that that's a really fascinating value add that HealthSnap brings, is that human connection. And even your strategy to keep the same nurse with the patient. It's so frustrating for me as a user when I call a call center or whatever it might be, and then they transfer me and then they have to repeat my whole story. And you're really, removing that element and allowing for this aging population to have somebody who is over time just compounding in knowledge of their situation, and could even probably notice like them being off on a phone call. Like, you sound a little off.
They know
Like,
them.
exactly.
The word that comes to mind is frustration. So many people, especially elderly population, are frustrated with access to care because they don't, they're getting handed off, like you said. They're retelling their health history. They don't have a trusted relationship with a caregiver. And I think that's the intangible side of it, to your point, that we didn't expect. And it's so powerful, not only for the relationship of the patient and their side of it, but the nurse-patient relationship that we've created that never existed before in healthcare.
Yeah.
It's novel. It's really, really powerful.
Yeah. What about the physician/clinic side of it? How did you guys get like into that world and really understand the complexities in order to drive value and be able to establish a partnership with them?
Yeah. I heard a phrase early on in our journey that has stuck with me to this day and will always stick with me if I, working within healthcare. And it's a great slogan for anyone building in healthcare. And it's build a solution that patients love, that nurses don't mind, and that doctors don't hate. And if you do that and you continue to create products around that and test those three, you're going to be okay.
Mm-hmm.
What we found is that
Not easy.
Not easy, easier said than done. But what we found is that when you work with a health system that's really complex, they have all these competing priorities. They're really, really busy. Number one, you need to understand the business of healthcare. You can have the best life-saving solution in the world, but if the health system doesn't have a financial ROI associated with it, you will not get the mass adoption that you might think you would get.
It's a business.
It is 100% a business. You would be shocked to hear some of the executive CFO meetings we've had with health systems, but that is the reality, that they are running a P&L and they are hemorrhaging money right now and looking for ways to diversify revenue streams and generate a financial return off of a program like this. When I say that, though, someone might think, oh, well, this is just a money grab. We're just trying to make money. But the reality is that financial ROI is a byproduct of really strong clinical ROI. We say that all the time internally, that without clinical ROI, patient activation, patient engagement, patient retention, patient outcomes, patient satisfaction, that financial ROI will not last. It will not be sustainable. And so when we started thinking about it that way and positioning ourselves as that, we started to get really good traction. Then you have to think about the business model of the company, where we were creating a low risk business model for our partners that was only upside for them long term. We basically bet on ourselves. It's a risk based financial model. So that created lower barrier to entry for us. And it creates a really sticky product because they're not outlaying capital in millions of dollars or paying all these software implementation. So we created a financial model that worked.
I want to unpack that in a minute.
Sure, yeah.
So finish with that.
And then the last piece of this is we have learned tremendously about how do you integrate this into the health system. It's one thing to say we have this amazing platform, we have patents around it, we have all this staffing, but if it doesn't the data doesn't flow into the clinical workflow that they already have, that it's not creating 12 more clicks for them, or they have to go to another software, you're gonna be politely asked to leave.
And that's different per medical system.
Oh, it's very different because there's a dozen different electronic health records. And even within the same health records, they have different types of them and instances and different setups. It's a hot mess. It's very complex. Interoperability was a really big buzzword in the healthcare industry about 4 or 5 years ago. It's still a real thing. But
Which means
creating data flow across systems.
okay.
It's consistent records across systems.
Yeah.
If I'm a doctor at Baptist, I can access records at UHealth and it's the same one.
But that doesn't exist.
Yeah,
Right?
it still doesn't exist.
Okay, so
No.
I think they're still trying to create it within their own system
Correct. It is very far from
to
existing.
then
Yes.
connect to others.
So you can imagine for us, like we're the record of care for like care between the visit. And so if a patient of ours goes to another system, we still maintain all of that. So it's almost connecting the gap indirectly, but just getting the data from the machines and our clinical staff into the patient's chart. And then all the financial billing data on the back end, its revenue cycle. If you like, all of that is extremely complex, and we had to solve for all of that over time.
Yeah. Essentially, a project management implementation for each single partner that you work with. And I don't know, how long does that take to unpack?
Yeah.
Once you like sold them and they're on board and they're like, let's implement.
Yeah. For anyone that's trying to sell to health systems, a sales cycle, I'll give a very specific one. I won't name the name, it's not public yet, but a major health system we just sold took us 16 months to sign. So the sales cycle was 16 months, over a year. The implementation is going to take anywhere from 3 months in a very, very aggressive case, potentially up to 5 to 6 months, depending on the complexity of the integration and the level of expertise they have on their team. So it's not only the systems, but also their team as well. Do they have dedicated IT resources? And sometimes they say, no, we can't integrate right now.
Right.
And then we can't scale. And so we have to figure out ways to get really creative with them to do a lot of the work for them to make this work and move at a pace. Because if you hang your hat on a health system, you could be looking at 20 months before you start seeing a single dollar of revenue.
Right. Part of that is also probably getting the right buy-in from the right people.
Oh, 100%. If you go in through like a physician and try to go up, no, you won't get adoption. All of our enterprise deals are through executive down. It's a mandate through the health system, through the executives, and these are system-wide initiatives.
Yeah. And let's go back to the financial model of it.
Yeah.
Like help, people listening understand what is the financial model that you were able to propose to these systems that they said, hey, this sounds great.
Yeah. So just 101, right? Like you go to your doctor, they do a physical for you, they bill a CPT code. That CPT code is associated with that visit, whatever they did, and they get reimbursed a set amount. That is fee for service. That is what most of our health system is in today. They do a service, they get paid for that service based on the insurance company, whether federal or private, and it ends up becoming almost like a farming system. It's higher amount of bills, higher amount of revenue, and that's why our system is stuck right now, because they're focused on volume and not value. Whether I actually do a good job at your physical exam or not, it doesn't matter. The insurance company is going to pay that doctor or that system the same dollar amount. So that is one component of it. In the industry, they're trying to shift from volume to value with a new concept of value-based care that's been talked about for 15 years, where a health system says, hey, we're going to manage these patients that are associated with this insurance companies. The insurance company is going to pay us a fixed per member per month, a dollar amount per year. And whatever we don't spend treating on that, we keep. So it's all tied to savings and reduction of utilization. That is less than 2% of the total amount of dollar flow to a health system for most health systems today, unless they're a at-risk system. A lot of West Coast systems are like on the other end. Majority of our U.S. healthcare system is still fee for service.
Yeah.
So we needed to think about a business model that would work within both, but the larger pie is fee for service.
Of course.
So our business model is, unless you're able to generate some type of fee for service event in the initiatives that we do, we don't charge a flat per patient per month.
Mm-hmm.
So it's only based on utilization of the program.
Mm-hmm.
So you don't pay anything up front. If the patient doesn't engage with the blood pressure cuff or doesn't talk to our nurses, we charge you zero.
Mm-hmm.
So you're not risking capital there,
Right.
on a system side. But if the patients are engaged, they're hitting the benchmarks, you're able to bill, and we automate all the billing for them on the back end. Then we charge a fee that is a percentage of the total reimbursement.
Mm-hmm.
So your net profit is in month one as a system. So no capital up front, you're making profit in month one, and it's all upside for you. And we're betting on our ability to activate, retain, and engage those patients through these types of programs.
That's so good. And why was it so important to white label HealthSnap? So whenever a patient interacts with HealthSnap, they're interacting with the healthcare system.
Correct.
They're not hearing, "Hi, this is HealthSnap."
Correct. Yeah.
Why was that so important?
Yeah, if you talk to your parents or your grandparents, they're getting hit up for scams and phishing attempts. And I think there's so much awareness around, like, don't pick up a number you don't know, don't talk to strangers. Like my grandmother, who's still alive, thank God, she's 94. But she's had that happen to her where, like, someone will call her and say, hey, they use like one of their grandkids' names and say, hey, they're in trouble. They need $5,000. You need to like, there's a lot of really terrible scams out there. And so we recognize that we're a third party company. They don't know our name. They don't trust our name. But if there's anyone they trust, it's their health system. It's their doctor. The level of white labeling we do is not only designed to create trust for the patient, but it's for continuity of care and for our health systems to be the heroes. They're the ones innovating. We're like the Intel inside powering these programs for them. And that for us is a commercial tactic to create really high sticky engagements with our customers. We have churned zero health system logos in our company's history because we're powering their programs. They're the ones that are creating that brand loyalty in regional markets around the country, and the patients will respond to that. And the white labeling all the way down, things you don't think about, but we'll do like regional area code phone numbers, but it can still show up as spam.
Mm-hmm.
So we take it one step further and actually do branded caller IDs, and we'll put the health system name on the phone caller ID. So when the patient gets a phone call from us, it'll actually say Baptist Health South and the regional area code and its dedicated phone number. So all of the calling, the marketing materials, fully white labeled. HealthSnap does not exist. We're in the background.
What does it look like to obsess over the patient experience? Because everything that you're saying is coming from that lens, right? And I think that as you apply, you probably start thinking and noticing, and team members, or feedback from patients, what has that looked like to obsess over the patient experience?
Yeah, when you're building, you have to create a North Star and anchor. In 2024, we did our all hands kickoff, and I literally said the phrase, our motto this year is to obsess over the patient experience. I'd said those words, and that was our North Star for last year. It's our North Star forever. But it goes back to the phrase I said before: build the solutions that patients love, nurses don't mind, doctors don't hate. Regardless of what the clinicians and our customers wanted, we always brought it back to like, well, that's not best for the patient. Or if someone internally says, hey, I have this idea, I want to create this new workflow or a new product or whatever. And we always say, well, how does that affect the patient experience? And everyone is challenged to do that. We challenge each other to always bring it back to that. And if you keep that common ground for the business over time when you're innovating, you'll make sure you never lose sight of that. Because like I said, strong clinical ROI leads to strong financial ROI, not only for our partners, but for us. And the patients are the lifeblood of our company and the service that we're delivering. So I think that's incumbent upon leadership to create that North Star and to set a mandate to say, we don't do anything unless it's improving the patient experience in our line of work.
Yeah. I want to dive in a little bit more into community. I use this word interchangeably with like network, meaningful relationships. It's kind of just what I feel to be like a more holistic word for those things, essentially. So I wanted to ask you, how do you think about community when it comes to building a business? So let's think of it from like a professional lens and perhaps from a personal lens. We can, separate those two. But, how do you think about it?
Yeah. So I started the company at 22 years old. I had zero business background, literally knew nothing. Which I think was an advantage at that time because we were just really naive and motivated to like try to build in a really complex industry and didn't think about the things that could go wrong, where I think a lot of people sometimes can get caught up in like all the challenges without just saying we're going to iterate and build and test and then see what we get out of it and take it one step at a time. Um, but I think of community as like it's the most important thing, especially as a CEO, because it's the most lonely journey you can take on your own. Um, I've talked to a lot of other founders that are starting or in some type of mid stage or later stage, and we all deal with the same problems. And you typically don't have anyone to talk to. Sometimes there are issues you can't talk to your co-founder about. Sometimes there are issues you can't talk to your spouse about. Sometimes there are issues you can't talk to your board about because there are things that you don't want to create exposure to. And so that's where I think community comes in, or like that support system that allows you to talk in a very objective, unbiased way. And that can be in the form of mentorship. That can be in the form of like a founder peer-to-peer group that's also building alongside you. I've joined professional organizations with other CEOs, and we get together, we do dinners, and we talk about it. And just I think the cathartic feeling of talking about it helps recognize that we all share in similar challenges. It's not unique to you. And I've always taken the approach of like talk to people that have done it before, that are steps ahead of you, that you can learn from. And then you start realizing pretty quickly that most people are figuring it out still. No one has all the answers. We're all trying to find our way and learn. No matter if you're $100 million company or just getting started, the challenges are consistent throughout. And you'd be surprised to see how responsive people are to help if you ask for it. And if you expose yourself to saying like, you don't need to be the person that has all the answers and put on the facade of like, oh, I'm the CEO, I know everything. Because at the end of the day, you start peeling layers back. A lot of people are really insecure and living a lot of anxiety every day around performance and the responsibility of keeping people employed and, making sure that the company doesn't run out of money and we keep doing it because that's on you. And if you don't have a sense of community to talk through those things, you will be in the corner shaking over time. And I've been doing this it's my 10th year this fall building the company. And there have been times where, yeah, I was like, I'm done. I can't do, but you find that sense of community, you pick yourself up and you take action to try to just talk through it. And I think it's the thing that will make sure your mental health can stick, not crushed over time, because it can be soul crushing at times.
Yeah. Can you think of a time that you were in a valley through what you've been building with your company and how you found a way out of it?
Yeah, I mean, there were two times in our company's history where we were less than a month from fuming, running out of cash completely. I think the most intense time period was right after COVID. We had a fundraise planned before COVID actually kind of like the big news came out. But earlier that year in 2020, we had a fundraise lined up. We had a great plan ready to go. COVID hit and literally everything fell through. So we're staring at 2 months of cash in the bank, customers, we're trying to figure out how do we just stay alive. But this is, I think a lot of companies probably dealt with similar things like this. But at that time, though, it kind of goes back to like, you have to take immediate action or you're gonna have to just deal with the ramifications of inactivity or just you're gonna sit and sulk. And I think that's where like leadership really comes in to communicate to everyone the plan. Everyone wants to hear the plan.
Yeah.
And I think at that point in time, I was, really focusing on talking to like family and friends and just understanding like I didn't need to solve for anything. I just needed to make sure that what I was thinking through was on track or get some validation externally outside the business. And we found our way. We kind of came together. We, sold a big deal that paid us cash up front, kept the lights on. And then later in that year, we were able to pull together a meaningful fundraise and keep the company alive. But there was a 6-month span there where it was like manic, like this is done. We're not going to make it. Really, really, really painful time period for us. And, at the end of the day, you have to lean on support and people just to talk it out with, and then just put a plan in place and take action. It kind of was like what we started with in today's discussion.
Yeah. It sounds like you have a lot of strong relationships surrounding you as a leader, as a person, which I think is incredible. I'm curious to know, have you ever been really intentional about pursuing someone for as a mentor or as an advisor that you saw, like, I really need this personally, and how did you go about finding those people?
Yeah. Um, I try to segment it into a couple buckets, right?
Mhm.
I was in a fraternity in college at the University of Miami. Most people think of like fraternities as like, oh, it's like your drinking buddies or whatever. We were super, super grateful to find a group of friends that are thick as thieves. Like we're brother, like actually like the closest people in our lives right now. There's 12 of us in a friend group.
I love that.
We call each other when we're at the lows of the lows, and we share wins, and we talk to each other. I think my friendship foundation, and one of my co-founders, like I said, is one of my best friends who's local in South Florida. We really, really lean on each other for everything in life. And not everyone has that, especially as like founders that are starting and maybe they don't have like a support system of friends. Like that was something, especially in the early days, like all of our friends were rallying around our wins, and they were in it and supportive from day one, which is special and again unique to I think for from us in the beginning. Um, Beyond that though, like seeking out mentorship as we started raising money early on, we did friends and family. So then I was like, okay, friends and family. I had brought on some advisors through like my family's network that were entrepreneurs, and
Great.
those advisors were someone that I leaned on all the time. I said, hey, this scenario is happening. What do we do? I'll never forget an advisor early on. He's a CEO. And he said to me, like, do you want to be a rocket ship or do you want to have a lifestyle business? Neither is good or bad, but
Correct.
you have to make a decision now. And so like I started those types of like conversations always stuck with me. I think I was 23 when he told me that, going,
Wow.
whoa, like you start getting really intense and you're nervous. You start looking up at them. But along the phases of like your CEO journey and like this is my first company, but I feel like I've had 3 in 1 now at this point.
Totally.
You get people along the way of stages that will give you that guidance. So like I said, it goes back to like I seeked out those types of people that were CEOs that had been there, that had done that had guidance. Some of it was not right, but you listen and you hear, and then you end up making your own decisions at the end of the day and learning from it. And I think that's something that's really important too about mentorship of like, they don't have all the answers about your own business too. So you still have to make sure that you use your own intuition and decision-making skills, but you're still hearing perspective, and being able to collate perspective, I think is something that makes a really, really strong leader and entrepreneur as well. Cause
Mhm.
you're going to get differing perspectives along the way, especially as you start going. And then we raised our seed round, and I'll shout out Florida Funders because I was just at their event yesterday. One of their partners joined our board, and he was a very successful health tech entrepreneur. So then I kind of felt like I got leveled up. So I got access to someone that he built a business for 18 years, bootstrapped it himself, sold it for almost $500 million.
Amazing.
And I'm like, okay, I got to lean in. And so we would talk, we set up weekly calls and we talk, and he became not only a board member, but a personal mentor for me, where I felt comfortable to be able to talk about it. And you got to lean into that. And I think sometimes it's easy to get lost in like, oh, they're an investor. Like I can't express how I feel or challenges, but they are there to help you. And if they have done it before, they know what it's like, and they want to talk through that with you and help you, because we all have a vested interest to help each other win and be successful. And I definitely sought that out early and often.
Yeah, and whenever one of your mentors early on asked you, "Do you want to be a rocket ship or a lifestyle business?" Did you in that moment decide that you wanted to be a rocket ship, or did that kind of simmer in your mind? Where did that land for you?
Yeah, I love that question because whenever I talk to entrepreneurs, I actually ask them that sometimes too, and like I kind of pressure test. And if they balk, if they hesitate at all, I immediately know in the back of my mind they're not ready.
Hmm.
And so when he asked me that question, I said, "Oh, what about a rocket ship?" Immediately, boom, we're in. We want to go. And so I think that mentality though is not for everyone. Doing the rocket ship ride, raising venture capital, going for the home run. it takes a certain level of, like I said before, obsessive passion over a really personal, deeply personal problem that you will not stop at anything to try to solve for. And in that time, it was definitely like, all right, we're in it, and we're gonna go and not let anything stand in our way along the way.
Yeah, because it's a lot of pressure that comes along with that,
Yeah.
and a lot of work, a lot of gray hairs.
Yeah, you can see them. It's funny. I was on a call with someone that I had talked to, I don't know, 7 years ago. He goes, "Oh, yeah, you've got a couple more grades." I go, "Yeah, I earned all those. I earned every single one of them."
Absolutely. And I think it's such a valid question. It's a question I asked myself when I started my business too, because I've been working with startup founders for almost 15 years now. I think it was natural for when I stepped into my business to be like, oh, well, am I going to build a startup? Like, what do I want to do? And I quickly realized that that's not what I wanted. I don't want to build a startup.
Yeah.
Like, I want to build a business that is more sustainable for my life. And I've worked a very intense corporate career. And right now in this season, for sure, this is what I want.
Yeah.
That might change in the future. It's harder to change when you choose the rocket ship first.
Completely. You are signing up. You are taking on a liability when you do that.
Yeah.
And I don't think people really appreciate that. If you go and say, "I'm going to be the rocket ship,"
Totally.
you go raise a Series A, you just took on a liability, and you
Yeah.
have I wouldn't say a debt, but you signed up for it. You're
Yep.
in.
Yep.
And it's really, really painful if like you do that and then don't truly recognize what you're signing up for and the 5 to 10 year journey that you're taking on and committing to. And on that point, though, there is no good or bad.
Correct. And
It's a personal decision.
exactly. And I think that there's a lot of like glamour and gloss to being a startup founder. You get these awards, you get invited to these like awesome events. There's a lot of admiration for somebody who's building a startup, like from our community. I think like culturally, it's very celebrated, but I don't think there's anything wrong with choosing a different route whatsoever. You know what I mean? And honestly, if fame, glamour, and the glow of it all is what drives you, then you shouldn't be doing it.
I could not agree more. You have to be so humble, like the level of humility that needs to be checked every day. Like if you're in it for accolades or being able to like speak on a panel, you will not make it. The most rewarding part of business building is creating a space for a team to work on a common goal, to employ people that are super passionate about a shared problem, to celebrate wins and losses and shared experiences together. That was what will fill your cup and give you energy. The award side of it, if I get something or I feel nothing, zero. I just got an award. Everyone's like, congrats, blah, blah, blah. I felt nothing. Job's not done. We got to keep going.
Yeah.
We got to keep going.
Yeah.
I don't care.
Are there any situations that have happened that you could share with us that have been like a moment to kind of like level you out again? Not to say that you're not humble, but I think we all struggle. I mean, speaking from my own experience, I've in moments, experienced success or been at the top of like what feels to be the top for me, of something. And then like it can creep up into my head a little bit. And then some situation will happen that kind of like reminds me, like, stay humble. Stay humble. Like, you are so much smaller in this whole grand scheme of things. And I'm thankful for those moments because it helps me put my mind into the right perspective. And for me, it's been really important to be realistic about that. And not be like, oh no, yes, I'm so humble. Like there's time when I'm not humble and I like need those situations to happen. I believe that God allows for them to happen to kind of like put me on my tracks. And I think humility is a really important pursuit. I don't think it just stays there all the time. So have there been situations that have humbled you?
Bringing it back to like, I think what fulfills you as an entrepreneur, and that's about like people ask me like, what's the thing that like, what's your why in the business building beyond like my grandfather's story? But for me as a leader, it's inspiring my team to be the best version of themselves. That will translate into the right actions, doing the right thing, making patients love our program, happy customers that are paying, like all the like the resulting things. But if you don't have the right team, that will all crumble very quickly. I think for me personally, like the things that sometimes can get in your head, especially as like, a younger founder, you always think about like the glory of like raising money as like a huge milestone. We raised a $25 million Series B last year from a tier one VC. And again, when you raise capital, people think that's like the pursuit, but that is a means to the result sometimes, and sometimes a necessary evil of like business building. But that comes with a set of like understanding and principles about, okay, like if you're doing this and you're signing on for a very large valuation or whatever it is, you now need to execute against a plan that you set. And so the work just starts. And so I think for me, sometimes like you can get caught up in like, oh, a big round, you're talking to media, you get lost in the sauce a little bit about like, oh, we're crushing it. But then you have to kind of start facing your team and go, hey, this is the plan we're signed up for, and we're in it now for another cycle. And if you don't, if you're not on the ground and actually understanding with your team about like, I don't care if you did an interview with Forbes or you got featured in this Meteo, whatever, or panel you're talking about it. You have to make sure that your team is feeling a part of the greater mission and vision every time. And there have been times where, yeah, you lose sight of that completely because you're the one that's being interviewed and, you're getting pulled into all this really cool stuff that you aspired to do when you first started the company. But that is not the end point. That is a step along the way, and the business building side of it is what is meaningful, and making sure that your team is being filled along the way. And so I think there have been times where, yeah, absolutely, you think you're a high flyer and you'll get smacked in the face because something bad happened with the business, or you have an unhappy executive or whatever it might be. And that's the real stuff.
Yeah.
That's the real stuff that will check you very quickly.
Is there anything you do to stay grounded? It can be professionally or personally, to stay like focused and grounded.
Yeah. Visually, I always like try to tell everyone like your emotions have to stay here. They can fluctuate in there. But if you start feeling yourself going up or down, like you almost have to like step away sometimes. We live in Miami. There's a lot of distractions. My wife and I are, we're big foodies. We go out a lot. So like for us, I think like we definitely try to make sure, especially because I work from home, like there is no work-life balance. It's work-life integration.
Yeah.
In my seat, especially, it is my life, and I have to make sure it's integrated properly into my life. So, I definitely create like discrete boundaries around like work versus my personal stuff. Every year we make sure like even just a routine trip can help significantly. Like we do like a trip to like a rural part of the country, and we get away and we unplug, and those things, you really have to do the saying, oh, I work 7 days a week and 70 hours and I'm grinding and, I'm like the hardo with work. You will not make it if you do that and don't check yourself in terms of like the work-life integration balance, I'll say, and making sure that you have foundational, plans to support that is really, really important. Like that takes proactive work. And if your physical and mental health isn't where it needs to be, the team will suffer, the work will suffer. It's so important. It starts and ends with the leader.
Do you have like a weekly routine, like working out or anything that is kind of like more a part of like your day to day?
I think I get my most peace mentally when I walk my dogs, honestly.
Yeah. What kind of dogs do you have?
I have a golden retriever, and then it's actually funny. When I met my wife for the first time, she had rescued a dog. Had no idea what breed he was. Someone, I guess, went to her and go, "Oh, your Great Dane is beautiful." And she's tiny. She's 5 feet, small girl. And all of a sudden, this dog is, I guess, shooting up. And I just met her. And she did a genetic test. He's a Weimaraner American Bulldog.
Wow.
So he's basically a German hunting dog that's jacked, full of anxiety, but he's a sweetheart. And so yeah, the two dogs met when they were like both one. They're the same age, fortunately. They're both they met when they were one, and they're inseparable. So
that's so sweet.
Yeah, they definitely keep me sane as I go on walks with them. It's kind of like my thinking time.
Yeah.
But yeah, I definitely like nutrition and physical activity, or I kind of practice what you preach.
Exactly.
So yeah, definitely working out 4 or 5 days a week and going on walks and making sure And it's easy to lose that. Like, there were time periods where, especially as like I moved in with my girlfriend at the time, we moved in, it was kind of like a happy period, and you start realizing your habits all change, and people like those life events though can affect everything
So much.
so much. And you have to be very intentional about taking care of yourself,
Yeah.
because it is a long journey, and you won't make it if you don't take care of yourself.
Yeah, it's amazing how much walking can really help. I feel like just, putting your body in action can just let your mind release and like process a lot of things that sitting down, like it won't happen. So I love practicing that as well. I have a dog too. So
Yeah.
taking her on walks, or sometimes even taking her on walks with my husband, I really enjoy doing that. Um, you guys grew from 60 to 500 people
Yes, we did. Yes, we did.
in like 2.5 maybe years.
Yeah.
Pretty short amount of time.
Yeah.
How do you do that?
Ah, a lot of challenges along the way, but yeah, I think the something I start talking about now is like the cycles of being a CEO in different phases of the business. When you're just starting, you're three people in a truck and it's all you're doing everything. And then at a certain point, you start to have to realize that, like, okay, to make this scale, we have to start delegating and putting process in place and bringing on the right people. And um, when we raised our Series A, our lead investor at the time, we had a plan in front of us to like hire the next set of management and VPs and all the department level stuff. And I'll never forget it. In a board meeting, he looked across the table from me and goes, "If we get this wrong and we hire the wrong people, we will die. It will make or break the company by who you bring on in this next phase of growth." As you're going from, trying to get to 1 million in run rate, and you go, okay, we're at a big milestone, and now we want to get to 10 or 20 and eventually 100, keep going. The people that you hire will make or break the company. And so I made myself the final decision maker in every single management hire. I was involved in all of that. I think sometimes a founder can delegate that too much to HR, and you kind of don't realize, like, does this person have our culture? Do they believe in what we believe? Are they an asshole? Like, you have to really spend the time. And we were flying out. I was flying around the country to meet with candidates in person during COVID.
It's incredible.
To say, hey, we're going to have a meal and we're going to sit down and we're going to talk.
Yeah.
I'm going to get to know you.
Yeah.
And so, like, people talk about like the beer tests, like, would I have a beer with this person? And it's so important when you're business building, because it's not when things are going well, it's when things are going wrong that you have to lean on that person, and they don't start pointing fingers or playing the politic game or deflecting or whatever. You have to trust these people like their family, and be able to recognize that they're going to be arm in arm with you during life's hardest moments as you're business building. And you can easily overlook that, like, as you're trying to hire that type of people, because then they're hiring the next wave of people below them and building out teams, and they're setting that tone and culture. So it took a really long time to get the foundational pieces in place. We've had leadership changes, we've had management changes, we've had to make those painful decisions over time, because they're either not a cultural fit, or they're not hands on the keyboard in the way that we needed them to be in a high growth company, when they said they were in the interview stage. And so the people management side, the recruiting, the performance management, the cultural side of it, it's more art than science. And you really have to find out what's right for you as the founder leader, because they're going to look at you and you're going to set the tone about what's allowed and what's not.
1,000%.
And so we were, again, I made sure I was in those interviews and meeting them and flying around to do that. It takes a really long time, a lot of effort, but if you get it wrong, it can kill your company.
Yeah.
And so that's definitely guidance I would give to any entrepreneur of, like, take the time to hire slow and fire fast. Like, take your time. Don't rush a hire just because you have had it open for 4 or 5 or 6 months. It'll do more damage if you just rush a hire and bring on the wrong person.
Yeah. No, that's great.
Yeah.
And at the end of the day, the culture is absolutely a shadow of the leader.
Yeah.
You can't get away from that.
Yep.
One time I was talking to a VP and they told me, like, I don't want to have that much influence. And I thought to myself, you shouldn't be a VP.
Completely.
Like, you shouldn't be in that role if you don't want to have the influence, because it's you can't choose to have or not have that. Like, you simply have it.
Yep. I always talk about it internally, but everyone wants the promotion. Everyone wants to go from an individual contributor to a manager to a director to a VP to an executive. It's like, that's like the natural career path that most people think about of like, oh, I'm making it.
Right.
The reality though is that be careful what you wish for, because once you start managing people, they're looking at you. There's no one else. And you have to be ready for that, to coach, to mentor, to hear the challenges they're having in their life and coach them through performance while something happened personally. Like, that's really, really hard people stuff. And again, if you get that wrong with the management or executives that you bring on for the company as you scale, there's real ramifications that are very hard to turn back and can set you back 6 months or a year even, or could kill the company.
Yeah. In those conversations when you're having a meal or a drink or, a meeting with somebody who you're considering hiring, what are you looking for?
Yeah. By nature, when you talk to someone, when you interview them or just get to know them, they immediately start talking about work, their career, their background. And I always stop them and I said, no, I don't care about what you did. I want to know about you. Where did you grow up? What did you do? What are your hobbies? And you start building that like human to human relationship, and immediately you start seeing them kind of, the shoulders drop and they start opening up, and you're like, okay, look, I'm talking to you as a person right now, and I want to just make sure that we get along. And so when you start doing it that way, then people start recognizing like, oh, this person isn't, they don't know, you're a stranger. They're like, oh, they're not evaluating everything I say. They don't care. I don't care about prior accolades. I want to make sure you're the right person for the work we're doing. So like the CV, the resume, if you worked at Big Co that went public, it doesn't typically translate. What translates is, are they obsessive over the mission, or are they passionate or equally as passionate of the other team members about solving the problem we're trying to solve for? And do they believe in the mission, vision, and values that we're setting out to build? That's what I look for. And I do that indirectly through their own life's work, their career path, examples that they had in their career when things were challenging and how they solved them. And from a leadership perspective, I'm looking for soft skills. I'm looking for things like, give me an example of how you've coached or mentored someone, or like, what was the biggest problem you had at your last company? And, give me an example of how you worked through that, and then whether it worked well or not, and why do you think they worked well or not? Like those why questions and open-ended ones will get someone to give you more about who they are as a person. And when things get tough, versus, oh, I'm proficient in PowerPoint, or I'm a back-end engineer that is the best in SQL engine, like that. I don't care about that.
Yeah. What's the culture like at HealthSnap, and what type of profile excels at HealthSnap?
Yeah. It starts and ends with me, in terms of like, no one is better than anyone else. Everyone checks their ego out the door. I don't care if you're an executive or an individual contributor. Everyone has an opinion, and I give the space to express that opinion and perspective. And it's a teaching and learning culture. Like I want to be challenged. I want someone to say, Samson, you're wrong. And here's why. And here's my recommendation. And here are the trade-offs of those recommendations versus what we're doing now. I love that.
Yeah.
I encourage that. And if you say that, like I say that to my team all the time, all of a sudden you'll start realizing that people have a lot of amazing, amazing ideas.
Totally.
But if people work in fear, or there's like, like the typical corporate org structure hierarchy, all of a sudden ideas start getting diminished down the line. And then before you know it, you're not innovating and information's not flowing. And we're a remote company. And like that is the lifeblood of making sure that we're over communicating, that we're building trusting teams. The most trusting teams are the highest performing teams. That's like a Navy SEAL, like a Dodge, like that. I love that. And it's really true.
Yeah, that's really good. And it can be tricky once a culture gets stuck in a very hierarchical model where like the intern doesn't feel like he can say anything in the meeting. I think it's very difficult to break out of that. So very cool that that's the culture that you're setting. I was going to ask you something about, remote work.
Sure.
So you said you guys are fully remote.
Yeah.
I feel like there's some challenges with that.
Yeah.
How has that been, and how do you navigate the challenges of remote work?
Yeah. So we had 17 employees in 2020. We went fully remote after COVID, or when COVID started, and we're now a little over 500 full-time employees for the company. So we have scaled exponentially fully remote. number one is that you have to be like very, very, very proactive in how we create communication cadences internally. So weekly leadership meetings, monthly town halls, um, documentation, I think, is the number one thing that a lot of companies get wrong. We use online tools like the Atlassian suite. So like Confluence is a really good example of a tool that is like our home base, right? Every single department has their own space. And I literally tell our leadership, treat it like your living room. You are responsible for what goes where, how you own it, the organization of it. And we pride ourselves on documenting meetings, processes, workflows. Everything lives in a central repository that I can go in and go, okay, marketing, boom, here's what we're doing here on this project. It links to project. Like, if you don't have the infrastructure like that, and you just say we're going to be a remote company, it's really hard to get information flowing, and you're going to have to meet. Versus working asynchronously on projects and leveraging remote workforce tools that are designed for that.
Yeah.
So the cons of that, though, are like I said it before, of like, you don't get the human element of the wins or shared challenges together as much. And so we've been a lot more proactive, especially in the last 2 years, of doing offsites with leadership teams and allowing leadership teams to bring their teams offsite.
That's great.
It's really, really, really important. It reinvigorates the team. Every year we do an employee conference. This past year, we actually had over 100 employees in Nashville, and we actually branded an internal conference called Reimagine. And that was the whole theme. And we set off the year and the tone. It was reimagine how we work, our solution, how we're innovating in healthcare. And we had a 2.5-day conference that we created. But that takes investment. It takes buy-in from your board. It takes buy-in from your leadership. But there's intangible ROI from getting your team together and then going back to remote work and almost treating it like a living, breathing thing where like I can feel if energy's low or people aren't communicating properly, and then I'll initiate and say, okay, we have to get people together or offsite or something.
Yeah.
You have to get a feel for that. So that's, I think, the pros and cons of a remote work.
Yeah, I think that's really important for a leader to have that sense.
Yeah.
Because it's definitely something that you feel. It's like more energy based.
Completely. The word that comes to mind is momentum. You can feel momentum across how people work and momentum in your work itself and the results. Momentum is the company killer or winner. Like, if you don't feel momentum cranking right now, you have to be doing something differently.
Yeah.
Whether it's getting people together to say, hey, what are the wins that we can do right here and now to start building some momentum and stack that momentum over time? Or do we have a good flywheel going and, hey, let's crank.
Yeah.
But those come in cycles and seasons.
Yeah. And what do you guys do during that offsite congress? It's like 2-3 days, or
Yeah.
what do you guys do there?
Yeah. So I always like start framing up with like wins and losses. Like, it's like almost like my State of the Union.
Mhm.
So I'm talking about, hey, this past year, here are all the things that went really, really well. Here are all the things that we need to do differently. And if we flash forward a year from now and we're back in this room again, what are we all collectively signing up for right now? So setting the tone like that, I think, gets people immediately rallied around a common North Star.
Mhm.
So like for us, it's obsessing over the patient experience is like a theme that we have set out before. And that sets the tone for the whole year. Another one is like the idea of leave no patient behind. So I'll create like an anchoring phrase. And this year was leave no patient behind. Whether that's existing patients, we make sure it's a concierge level of service, where new patients that need our help, we're going to leave no patient behind and make sure we take care of the patients that need our care because they deserve it. So setting the tone that way. Something that we did this year as well that I think was the most impactful is that we had an executive fireside chat panel.
Mhm.
And I actually had all of our leadership get up, who are typically very shielded from their emotions because they're executives, right?
Yeah.
They're like, we're driving numbers, it's all work, no play. It was the first time, I think, that we had the greater bit of the company hear the personal stories of our executives. And when they started telling their stories, tears literally started flowing. And I've never been in a room where you could hear a pin drop because someone was telling their story about their own healthcare journey, or how their parents passed away from cancer at a young age and how they would have benefited from our program. When you start creating the shared why, and I talk about the collective why together, you start creating that trusting work environment and that shared experience and that shared mission and vision. And that's where the magic happens. And it's really hard to do that in a remote environment. So when we get
Yeah.
together, like, that's my main initiative, is to make sure that we feel that level of connectivity.
And what did you sense afterwards as far as people's work and how you guys um, kind of, what's the word? Like how things like flowed after that,
Yeah.
work wise?
First of all, you had people that typically are not on calls together, or if they are on calls together, they don't work day to day. Now, all of a sudden, you get in a meeting, and this person in the patient support team knows the CRO of the company, and they have an inside joke. And so information starts flowing a lot better because now they can start talking differently and checking each other, or being more comfortable with knowing, hey, I know this person now.
Yeah.
We had a drink, or we had a great chat at dinner, or whatever it is. And all of a sudden work starts getting a lot more meaningful and more efficient, and um, more comfortable with checking each other if like we're not on track for where we need to get to, and the context behind it,
Yeah.
versus people taking it personally if you don't know that other person. And that's easy to happen if like someone says, hey, that's not the right thing, why are you doing it that way? And then you start taking it personally, versus, hey, Samson talked about it, this is our goal for the year, here's why we need to do it this way, and you're doing it this way, here's my perspective. And then all of a sudden people start working differently.
Yeah. What have these different stages of the company's growth, because obviously you guys have grown really fast, how has it required different things from you as a leader?
You go from the stage, like I said, of like you're doing the work yourself, then you start getting like some level of delegation in people, and you're still very involved in doing all the things. And then eventually you start going to like, we're setting the anchors for the business and the North Star, and making sure people know like what direction we're pointing in, and that we're all driving towards the ultimate end goal. And so I've had to find my voice more in setting the stage of zoom out a little bit more and say, if I had to put a 3-year plan in front of everyone, here's the 3-year big, hairy, audacious goals that we're going to set for the business, and here's what I want to see. Um, it's a lot harder to do that when you have, 5 people, because everyone's like, oh, like we don't really, and you're early on, you're like, oh, I can't really see that. But now you get people to kind of drink the Kool-Aid, and they believe. And when you start believing, it's funny, I'm saying believe this late in the discussion, but we had like a whole 15-month span of where Ted Lasso was really popular, and
Yeah.
everyone was like, believe, we can do this, as we were building and going from like earlier stages to, we went from, 7-figure run rate to well into 8-figure run rate in 15 months. Like,
Yeah.
people were like, I mean, that was really intensive work, but everyone just believe. And so my job has become a lot more around like the psychology behind work, the vision setting, especially as we're going through like series funding. My relationship with the board has changed tremendously with media now. So it goes back to like hiring the right leadership, because I trust that my team will do the right thing. They will communicate to me if I need to be involved with something and insert myself. But I'm not micromanaging the day-to-day of the leadership, because I know that we have the right team in the right seats, and we're all working for a shared goal that I've set from day one and continue to reinforce over time. And that's a different type of work than having to feel like you need to be doing everything in one, because you end up getting nothing done.
And when do you realize that, like, oh, there's a leadership shift that I need to go through? Because you're maybe like in the beginning, you're super operational, and then things start to mature, and you start to feel different pressures, and you're like, man, my role needs to evolve.
Yep.
When have those moments kind of stood out? Like, how do you know that it's time for that leadership role to shift?
Yeah. I think it happens naturally when you raise rounds of capital, because you have, especially hopefully if you raise from the right people, because those board members know the characteristics of what needs to happen, because they've seen it before time and time and time again.
That's good.
And so I lean on my board members. A lot of, I think, founders are scared to lean on their board members, or maybe they view it a little differently of like, oh, they're going to fire us if we don't perform or what. But if you communicate and over communicate, you can mitigate a lot of that. And more times than not, they know the pattern recognition of what should be happening to make sure you're set up for success. They have a vested interest to make sure it's wildly successful. So why would they do anything otherwise? So I think I've always leaned on, board members or independent board members, especially, that can be a sounding board, that I can talk about real challenges. And then as a leader, especially, you have to be a chameleon and like adapt to the changing environment. And sometimes if you can't do it fast enough, you'll kind of miss, right? You'll feel like it's moving beyond you. And you have to have a feel for that and the level of humility to recognize like, hey, I'm not doing the things I need to be doing, and proactively talk to someone to either support that or talk to your team to say, how else can I support? But you have to have a feel for that. And it's very different along those stages.
That's good.
Yeah.
How was the fundraising journey for you?
Uh, very arduous the last couple of years. It's been a very, very tight market in general. The best companies are the ones getting funded right now. Just because you think you're really good and you have all the, I guess, growth, or you think you're the best technology or whatever, the investors that I just from my experience, they're investing in you as the person. And I'll bring it all the way back to, do they believe that you're the person that's going to go all the way? That you're the best person in the industry that's so obsessed over solving this problem that no one's going to come close to beating you because you care so deeply about fixing that problem. If they don't feel that in the first 10 to 20 seconds of talking to you, you will not raise a dollar. And so that intangible soft side of the conversations is where I think a lot of founders fall short. And for us, we stayed in front of in the investment community over several years. And most importantly, we underpromised and we over-delivered. I never set an expectation that we were going to go from $1 million to 50 million in 1 year. And then all of a sudden they're going to check with you and say, well, where are you at now? Oh, 2 million. Wah, wah, like you just miss it. But if I said, oh, we're going to go from $1 million to 4 million and we went from $1 million to 5, guess what? They're going to go, oh, whoa, these guys know what they're doing. They have a plan. They beat their plan.
Yeah.
You build trust outside of the lines. And that's the kind of the dark side of, I think, fundraising.
How do you balance like not underselling yourself when you do that? Because I do the same. I like to underpromise and overdeliver, but
Yep.
sometimes I'm like, am I selling myself too short? You know what I mean?
I don't think there's a right answer, but I do think that we've seen the other side of it where like we will underpromise and overdeliver. And then guess what? The board members look at you and go, you guys are sandbagging. And we go, what do you mean we're sandbagging? We had a plan. We agreed to the plan.
What's sandbagging?
It means that you knew you were going to do better than what you told them. So you sandbag the plan.
Okay, got it.
So it's like, I knew I was going to do 10 million in revenue this year, and I told the board we're only going to do 5.
Got it.
And they signed off on the plan, and we blew it out.
Right.
And it's just a funny dichotomy because like you just can't win at the end of the day. Because if you underpromise like that, they're going to say you're sandbagging. But if you're too aggressive and then you start missing your plan, they're going to say, oh, well, you guys aren't performing. We might need to look at different people. So it's a strong balance, and it goes back to like having the real authentic conversations with board members about alignment and what we're working towards. And not only where I'm pointing the car and to what direction with the team, but also with the board and advisors, and making sure that we're all bought into the same end result.
How do you go about finding the right investors? Because not all money is good money.
I love that because it is not. Not only that, but you can start seeing a little bit of it during diligence of if they start writing term sheets that have terms that are extremely aggressive or out of market, probably not the right investor for you. There's been a lot of really, really bad stuff happening the last couple of years that I think could be a whole separate discussion. I think industry knowledge is so important. If you have a board member that has no idea how your business operates or the industry as well, when challenges happen, they're not going to be able to say, I understand. They're going to go figure it out. And you're in a really tough spot because they don't get the industry. And so I would definitely caution people to make sure you take money from individuals that have either built in your space or have a specific vertical thesis and they understand it intimately. It's really hard to try to communicate to a board member that doesn't get it.
Yeah. So did you have to cycle through a lot of different conversations to find the right fit? Did you have to close some doors and say, this is not for us?
But completely. Yeah. I mean, I when I talk to anyone about fundraising, I think it's all about like, I wouldn't say power leverage, but as an entrepreneur, it's easy to look up at an investor and say, oh, they have money. They're on the pedestal. You need to immediately flip that and recognize, and I'll give my dad credit for this one. he will instill in my brain every time we go, whenever we fundraise, he goes, you are the asset. You are the one that they need, not the other way around. And so if you start thinking like that mindset, and then start flipping the script a little bit on them and start saying, hey, we have all these investors that we're meeting with, here's our plan. And you create a little urgency that way. You can flip the power dynamic a little bit, and you start weeding out investors that way. So I think that naturally happened for us, whereas we were going through the Series B especially, you start weeding out the ones that really weren't committing. They were just happy to talk to you and wanted to string you along. And that can be really painful too.
What are some of the risks of bringing on an investor that isn't familiar with the healthcare industry, and the implications that could have on the relationship and the business?
Yeah, I think it can strain the relationship with the CEO and not only the investor or like board member itself, but the investment firm overall, because
Over what specific points would they not understand that's unique about healthcare?
if we start talking about like, oh, the integration is taking longer than we expected, and here's all the reasons why, they're not going to know what that means. All they're going to say is, well, you're missing your plan.
Or it's excuses.
Or it's excuses.
Right.
Or you don't have the right person doing the integration, then fire them and bring someone new in.
Mm-hmm.
Really tough spot to be in.
Yeah.
Really tough. Even if someone doesn't fully know, like our latest investor is not a healthcare guy per se, but they have a healthcare thesis, and he is a venture guy he's been in venture for 17 years. They have other healthcare companies in their space. I took it upon myself during diligence to educate and overeducate along the way to make, sure that he understood intimately how our business operates.
Yeah.
And so I do think it's incumbent upon the leadership as well to make sure that you're having those conversations, and we meet weekly and we go through it, and yeah, it's a very high level of engagement.
Yeah, because there's a very big market opportunity in healthcare. I think that perhaps investors can, be really interested, but like, how much do you actually know about how this works?
Completely. And I'll also caution one more thing that I think is good advice.
Yeah, please.
Sometimes, like in diligence, you'll find out who they're going to assign as the board member from an investment perspective. If it's not a managing partner that has been there for a long time and they assign a principal or an associate, I would caution anyone, because all of a sudden now you have someone that's just basically taking notes. That person can switch every 6 months. All of a sudden you have a brand new person on your board that's a stranger, because the investor or the actual group can assign who they're going to put on. And then it could happen where you have a new person and it's a complete stranger, and all of a sudden now you have to restart your relationship with them. And so that is a really big thing that I caution a lot of people of, like, not only do they get a board seat or one or two or whatever it is, but who are they actually assigning to the board?
Mm-hmm.
Because who they assign is so important. And if they just assign someone that's a principal because it's a huge firm and they don't care, you can create a lot of exposure for yourself.
Yeah, that's really important. What do you envision for yourself now as an end goal? Like, I don't know if it's too early to talk about this, but do you envision yourself, building out HealthSnap for many, many years, or like an acquisition, or do you have anything that you already have in your mind of like a future goal for yourself or HealthSnap?
I don't work in like the mindset of we're doing what we're doing for a desired outcome in terms of the business itself. I firmly believe that if you make a very successful, long-staying business that's generational, that impacts a lot of people, that will take care of itself.
That's good.
And if you build for an exit, you're going to build for an exit. And I don't think you'll get the right outcome you want, because you're going to start either creating shortcuts for the way you work. But if you start thinking about, like, there's a really good book. It's from Simon Sinek, and he talks about like the idea that business building isn't about winning or losing. It's a game of zero. Like, you're building to solve a worthy cause, and there's not a winning and losing. It's a forever thing. So if you have the mindset of building a generational company, 100-year company, whoever buys your company is going to look at that and go, that is an asset that we want. Mm-hmm. And you're creating a premium now because of that. So my mindset always is of, how do I build a sustainable, highest impact business, and the exit outcome will take care of itself. If I had to answer the question, though, about a likely outcome, I think an acquisition, there's going to be a lot of consolidation in our space. There's a lot of competitors right now that are starting to already consolidate, and we're fortunate to be a market leader where we're kind of staying our own and doing it organically. But I think our space is starting to get a lot of exposure right now, especially in politics right now, and not to bring up politics, but there's a lot of government review around these types of programs at the federal level that can create a tremendous amount of either tailwinds or headwinds for us in the next 3 to 5 years.
That's exciting. I like that mindset of essentially focusing on doing your best today versus having a end goal that you're working towards. It's like, how can we do what we're doing today with excellence, having the biggest impact possible, and then we'll cross that bridge when we get there.
Completely. Because if you put in your head oh, I want to sell the business in 2 years, what happens when 2 years goes by? You're going to be let down.
Yeah.
Or if you set that expectation with a colleague, an executive, or a board member, you just put a line in the sand. It's really dangerous.
Yeah.
You're creating expectations. And so I never like talking about a timeline or who we're going to sell to. I want to build the most impactful, sustainable business, and that will be a resulting outcome of that.
Yeah, very good. What in the market right now is really catching your attention or your interest? Is there anything that's really standing out in healthcare?
Yeah, I mean, we're dealing with an unprecedented workforce shortage right now in healthcare. People, I think I just saw the range of physicians alone, MDs, is right now anywhere from 50 to 60,000 short. So we have a shortage around 50 to 60. In the next 5 to 10 years, that's going to balloon up to 100 to 150,000 physicians that are short. One of our partners right now, they have a 6-month wait time for a primary care visit.
Wow.
6 months. It's a premier health system, top 25. They have a 6-month wait visit. There's such fascinating technology right now being built around we were just at a Vive, which is the largest healthcare IT conference, or one of, and all the ambient listening and agentic AI tools. They make sense on paper. In practice right now, there's more data coming out on, all right, what is it actually doing in terms of the workforce shortage? What's the percent gain in terms of efficiency? I don't think it's the smoking gun or the silver bullet that everyone's looking for, but I think it's creating a whole new set of tools that is going to drive policy. Mm-hmm. I think that's where the magic happens, because as soon as you unlock policy that allows a care delivery model through conversational AI or agents, all of a sudden now you can start solving the workforce shortage. Mm-hmm. And I think we have to be really thoughtful as industry to make sure that it's done with fraud, abuse, and waste in mind, that it's clinically relevant, that there's trust and safety with it. We're starting to test some of that internally right now.
Okay, nice.
Which is really exciting for us to see how we can not replace clinical staff, because I think that's the biggest fear right now. It's never going to replace it, but have a efficiency unlock that has never been possible before, because you have, a voice agent that's calling patients, and if they pick up the phone, then routing it to a nurse, versus a nurse trying to call patients that are not picking up the phone and wasting time. That's a poor use of resources. So I think that's where I'm most excited about, is how is there efficiency unlocked through these different types of tools. And it is very real and happening. And we're already starting to look at ways to invest in these types of solutions.
That's great. So we've been going for an hour and 40 minutes. Can you believe that?
That is wild. Wow. I thought we'd talk for 3.
You thought 2 hours was too long, huh? Tell our listeners, how can people reach you and learn more about HealthSnap?
Yeah. So you can go on our website. It's www.healthsnap.io. I'm also very active on LinkedIn. So if you just search Samson Magid on LinkedIn, I will happily respond and connect with you. Otherwise, you can shoot us an email at hello@healthsnap.io.
Awesome. Well, thank you so much for joining us. Congratulations on everything you and your team have built. And I'm excited to see where you guys continue to take this.
Thank you so much. Thanks for having me.
All right. My pleasure. Bye, everyone. And that wraps up another episode of the Founder Tactics podcast. Thank you so much for joining us, and we look forward to having you join us again on future episodes. Don't forget to follow and subscribe to our channel so that you can get notified of all the latest interviews that we publish. See you next time.